Okay, activity number 4 is all about the specimen collection, transport, and also labeling of the specimen. So this is a very important part of in order for us then to really and specifically identify the organism that try to cause infection in the biological specimen. So you need to really perform here correctly each of your specimen collection process, because if you were able not to perform correctly and what you have recovered is the normal microbial flora, it would have a problem with the treatment of the patients. Because again, basically, what we are diagnosing here is supposed to be the true pathogen that try to cause infection and not the one na mga normal microbial flora. So we have in the laboratory manual, you have several methods for the blood for the specimen collection procedure, even that was being discussed in our lecture. So for our lab, we'll be concentrating into your two respiratory specimen collection procedure. So the first one, we have here the OPS or the Oropharyngeal Swab, or simply your throat swab. So the throat swab could be performed here like if the patient would have here the sore throat, like in the case also of your COVID, diba? So we could also collect the specimen by the OPS in order for us to diagnose here the viral infection. So aside from that, you could also perform the OPS in order for you to diagnose here mga strep infection. Okay, procedure for this one. So just be needing here the swab. We'll be needing also the tongue depressor. Okay, so procedure for that. Okay, so number one, have the patient seated comfortably, and then instruct the patient to open the mouth and say ah. Okay, and make sure here that the patient were able to keep the tongue at the lower position. So you can do that one also by using here tongue depressor. So with your tongue depressor in one end, anyway, pag nag-position tayo pag nag-hold tayo ng swab, dapat ganito. Hindi yung ganito ha. O hindi ganito, but rather ganyan dapat. Okay, so with your tongue depressor in one of your hand, okay, so ganon. Pag open na ng mouth niya, tongue depressor, depress mo ang tongue niya. Okay, and then insert your swab. Okay, and try to swab here the tonsils and the posterior pharynx. Okay, so kung ito siya, so this is your tonsil to side. So dito sa likod niya ang ating pharynx. The posterior pharynx or your posterior throat. So that's supposed to be the one you're going to swab, or even the tonsil, and even some inflamed area. So mga inflamed area, that's our pinaka-target natin. So make sure ang swab natin, we're not able to touch the tongue of the patient or even here the soft palate. Okay, pag na-reach mo na, i-ano mo lang siya, i-rotate mo lang. Okay, swab, swab, swab on that side. Okay, then after that one, your swab here, you can have your, okay, put that one in your slide for your gram stain, or you could also have that, okay, directly with your transport media in order for you to recover your organisms. So here, do not touch the tongue with the swab. Okay, or you should not swab also here the soft palate. So, ang pinaka-after lang natin, so we have here the posterior throat and we have also here the tonsils on the side. Okay, that for the throat swab. Okay, another one, a popular na procedure here would be the NPS or your Nasopharyngeal Swab. So basically, this one is also being collected here for the COVID. Okay, so the Nasopharyngeal Swab is dito sa ilong dinadaan ng swab. Okay, medyo uncomfortable tayo dito when we are performing this one. But the swab used here is not as big as the one being utilized when you are doing your OPS or your throat swab. Medyo maliit ito ang swab. And the swab here should be a flexible na swab para hindi siya ganun kasakit. Okay, procedure for this one. So first, Okay, usually, natin, ganyan. Half ipapasok hanggang dito. Okay, so usually half. Some of the swab, meron siyang marker or line kung saan, hanggang saan mo siya ipapasok. Approximately for the adult patient, so it should be 5 to 6 centimeter. So medyo ipapasok mo siya para makarating ka doon sa pinaka-posterior na nasopharyngeal area. Okay, procedure for this one, allow the patient to be seated in a comfortable manner and slightly tilt, okay, ang head ni patient, okay, para madali magpasok ng ating swab. Okay, so with your swab, you try to insert the nostril, papasok diretso, okay, until you reach here the posterior pharynx. Okay, so paano mo malaman? So some of the swab ay mayroon siyang marker or mark hanggang saan mo siya papasok. Or if you felt already na may resistance na medyo wala nang, okay, pinakadulo na, so try to start rotate. You try to swab by rotation. Okay, then kunin mo siya sa nostril niya, then ilipat mo sa kabila, ganun ulit. Okay, and then try to swab. Okay, after that one, okay, you try to put here your swab with your universal transport media. Universal transport media contains here a solution, chemical solution that would able to preserve, okay, your swab with the microorganisms. That also prevent here the drying of your specimen because pag nag-dry na siya, mamamatay na ang ating na organism. And another one is some of the swab, however, ang kanilang transport media ganun nakaliit. So, ginagawa ay binibreak mo yung shaft ng ating swab o hawakan ng shaft natin. May mga break point. Meron kasi mga culture media na universal transport media na medyo malaki siya na pwede mo siyang ipasok lahat ng swab natin. Pero may mga variant na ganito lang kaliit. So, pag nag-insert ng swab, so binabali ang remaining na part. So, may mga breakpoint dito na part. Or pwede you can cut that one with your scissor naman. Then after that one, you try to cover and make sure that one is, okay, properly sealed to prevent here the drying up of your specimen. Okay, part also of your proper specimen collection transport would be the labeling of the specimen, specimen container, even here the request form. Okay, so it should include here the following information. So it should bear here the patient's complete information, the first name, the middle name, and the last name. So also contains here the date and the time of the collection. It's very important. Date and time the collection process. Ideally, for all the specimen, it should be transported to the laboratory within 2 hours of collection process, especially if that one is unpreserved. But if you have here collected or your specimen has been put on the transport media, usually on transport media naman meron siyang preservative, so it could have delay on the transport of the specimen. But ideally, it should be transported within 2 hours of collection process. Another one, very important, type of the specimen, source of the specimen. So, pag type of the specimen, so, pag wound, for example, ang ating specimen, so dapat may, may source of the specimen or anatomic site where you try to collect the specimen. You should not label that was wound lang or drainage lang or abscess lang. But rather, nakalagay dapat sa ang part ng body mo kinolek ang specimen. The same through with your blood culture din dapat. Dapat naka-identify siya kung saan siya kinolek ng specimen. And you could also have here the physician name for that. Okay, so that's all for this specimen collection, transport, and processing laboratory activity. Okay, thank you.